Okay.
Hi, my name is Alex Carpenter, and I just received orders from Mr. Jackson to have a nasogastric tube put in. So what the first thing I'm going to do is just check his orders, make sure that I am aware of any procedures that's going to happen, so that it doesn't interfere with what I'm about to perform here. I want to check all my equipment here, my NG tube, make sure everything's in date, everything's intact, the sealage of the packaging and everything looks good. So now I am ready to bring everything into my patient's room and introduce myself. Knock, knock, knock. Hi, Mr. Jackson. How are you? My name is Alex, and I'm your nurse today, and I'm going to put in a nasogastric tube. Your doctor should have talked to you about this. Yes. Do you have any questions? No? Yeah. It's just so that we can get nutrients into your body right now because you're having trouble swallowing. Okay, you're good? Okay, the first thing I need to do is check for your name and date of birth. Can you tell them for me? Okay, and do you have any allergies that I need to be aware of or any pain? Okay, good deal. Okay, I'm going to go ahead and lift you up real quick, okay, so I can work with you. I'm going to lift you to a higher position, and then I'm going to have to stitch you up. Are you having any pain with that? No? Okay, so no contraindications for him to be in a high Fowler's position. There we go. You're doing okay? If he had a pillow, I would remove the pillow. Okay, I'll move this down. Okie dokie. Okay, I'm going to drape him. Make sure that we keep his gown soil free. And then I'm going to check for patency in his nostrils. Okay, mouth first. Okay, everything looks clear. I don't see any obstruction. Can you include one nostril and then sniff really hard like this? Okay, now do the other side. Okay, both nostrils seem equally patent, so I can go either way. Okay, and now I am going to wash my hands and glove.
Measure.
Well, first before I glove, I'm going to go ahead and measure my tubing. Okay, I want to measure from the tip of his nose, around his ear, and all the way to his xiphoid process. Okay, and I'm going to go ahead and mark that location with tape. Okay, there we go. Okay, now I already washed my hands. Now I'm going to glove. Are you doing okay? Okay, it's going to be a little uncomfortable, but we're going to try to get this done as quickly as possible. Okay? Here we go. I'm going to need you to hold this in your hand. This is a cup of water, and I need you to take some sips when I let you know. Okay? And this is going to help move that tube down. Okie dokie. Now I'm going to take his tube, his nasogastric tube, and go ahead and apply lubricant 4 to 6 inches from the end. There we go. Okay, you ready? I'm going to go in his right nostril. Go in. I feel the back of his throat. I'm going to go ahead and check for any coiling in his mouth. No coiling. We're good. Okay. Okay, this is where, as I was putting his tube in, I would have had his head straight back. Now I'm going to have him put his chin to his chest as I insert this, and he can start taking sips of water. Okay, Mr. Jackson, I need you to take those sips of water to help it down. Oh, I know. It's uncomfortable. Good. Okay, so it was inserted all the way in. I'm going to go ahead and to the location of the tape. I'm going to secure it to his cheek for right now, just so I can evaluate that there is no coiling in his mouth and that he is, the tube is in the stomach where it needs to be. Okay. There's no coiling. Okay. Hold on a second. First of all, can you talk for me? Can you cough or anything? Yes? Oh, good deal. Okay. Now I'm going to aspirate some gastric content to see if I can get any. I'm getting some residual, which is brown in color. Okay, I'm going to test that. The pH. Normally, the best ideal way to check for placement is for the X-ray to just make sure that it's in the stomach. But we're not doing that today, so I'm going to check for the pH of his gastric fluid or the residual. Okay, I have the pH strip in here. Okay, it's indicating that I'm at a 2.5 here. And that is showing me that I have the correct placement of my tubing. I'm going to go ahead and reinstitute my gastric juices, and there's some air in here, so I'm going to auscultate as I'm putting it in. I'm going to listen on the upper left quadrant where the stomach is. Here we go. There it is. We got it in. Are you still doing okay, Mr. Jackson? Good. Okay. So we're there. Now I'm going to secure the tubing on his nose. I'm using the split tape method, crisscrossing it. Okay. And then I'm going to apply another piece of tape right here across his nose just for added security here. And I'm also going to use a safety pin and a rubber band to secure the tubing to his gown so that it doesn't pull out. The tube won't pull out. Oh, it's a little tricky with gloves. Okay, that rubber band is going to allow for some freedom in moving his head. Got that there, and everything seems good. Are you doing okay? Yes? Okay. I'm going to go ahead and put you down at a 30-degree angle. You got to stay at least that. If you want to sit up, that's fine, but you can't go any further down because then it just won't work as well. Okay? I'm going to also put him in the safe low position. I'm going to check for the 4 Ps, make sure he's okay, and then make sure his call bell is there, and give him his teaching. Just let me know if you have any kind of uncomfortable feeling, like nausea or anything like that. So just give me a call, and you should be good. So I'm going to go ahead and take off my gloves, wash my hands, and then I'm going to go and document. What I'm going to document is the length, size, and tubing that I used when I placed that tubing, my initials, of course, the patient's name, and then also the gastric contents, the color of them, also whether or not he tolerated it well, and that's basically it. So I'm going to go ahead and leave the room, and then, my CPA or my patient care technician told me that he is experiencing some nausea, so I'm going to go in and check on him. Knock, knock, knock. Hi, Mr. Jackson. I hear you're having some nausea. Yeah, it might indicate that you have some blockage in your tubing, so let me see if I can do that. This is, of course, if he had the Salem sump where he's being suctioned. So I'm going to go ahead and assess for that. I'm going to disconnect from suctioning. He's already in a position as far as his seated position for me to work with, and now I'm going to put him back up at a good height for me to work with. Okay, and now I'm going to get some air in there, and then I'm going to see if I can get some gastric juices out to check for placement. I'm getting some residual there. So, okay. And then I'm going to go ahead and check for placement. Listening to the upper left quadrant for the stomach. Okay, I've got it in the right place.
Hello, my name is Julia.
Go ahead, take this off, and I am going to flush it out with 30 mLs of saline solution. 30 mLs. I'm going to go ahead and reintroduce this there. Okay, go ahead and put it in.
Assess what gauge I need. This is going to be for medication administration.
And now I'm going to draw it out.
Okay.
Okay.
I'm going to gather all my
And as I pull it out, I got 35 mLs. That means I have a difference of 5. So the extra 5 mLs are gastric juices. So I'm going to go ahead and document that in a little bit, and also the color that I see. Okay. Okay, I'm going to reattach them to the suctioning. And how are you doing? How are you feeling? Still nauseous? Well, hopefully this is going to help you. Just call me if you don't feel good in a little bit, but I'll be checking on you as well. Okay, would you like your bed back? And check for the 4 Ps again. Take my gloves off, wash my hands, get them in the right position, and then just document that he tolerated it well. Also that everything was clear. He's back put suctioning and intake and outtake if there was any. So that's it.